Let them listen to us. As we will be sitting down on the 70 discussing.
I'm really proud of Hani Baragwanath Hospital for coming out so strongly today.
Yes.
And what you can see from all the placards is that there are so many issues in this hospital. What precipitated this issue, you've heard, it's about the staffing issues. But this is historical. It's not just about today. It's not just about the end of this month. It's about a historical approach to this hospital from a budget point of view. They've always made us be a disadvantaged hospital. We serve a disadvantaged community. We're a disadvantaged hospital.
The Soweto community has not remained stagnant. It is a community where people continue coming into this area because they believe that access to healthcare is important. If you look at the informal settlement that was built behind Barra, this settlement was just built for people to be able to access healthcare. We're unable to give our patients the best care that they deserve. We continue to have long waiting lists. Things like basic equipment that our patients need, they continue to wait for it. So I think the public should also know that as health workers, we are committed, but we are also confined and restricted by what we are given.
You failed us during COVID with the PPE scandal. You continue to fail us daily, and we will not be silent.
The disaster that we sit upon today is just a beginning of a further rot of a system if we don't reverse it immediately. The need for additional staff at this hospital is premised on a single thing, and that is that this hospital has been disadvantaged with regard to the number of staff that are employed.
The shortage of staff has not ended. We still short staff despite the 800 that we have. By the way, this hospital does not treat patients only from Charlotte and from other hospitals. We get patients from other provinces, Limpopo, Mpumalanga, KZ, Northwest. But that is not all. We also treat patients from beyond our borders. You know, from Mozambique, Zimbabwe, and elsewhere and so forth. Right. They've decided that come in the next 2 weeks, on the 31st of March, that they are going to terminate the COVID post, the 819 post. As to what is going to happen to this hospital that can't collect its own waste material, the hospital that cannot provide bread for patients, the hospital that is so dirty we don't have enough cleaners, the hospital where we don't have enough porters, the young doctors and the nurses are pushing patients.
A government that we voted to power year in and year out to continue the legacy of apartheid. Yes. Enough is enough, comrades. Yes. We are sick and tired of a government that we put to power that find it very easy to quickly dish out money to those who want to commit acts of corruption. But getting money to help poor people, just to help us to get by, to get staff to treat our patients, to get food for our patients to eat, to get milk for babies. Just last week, we were collecting money to pay interns. These are young doctors who have just finished 6 years of studying, just to pay them to buy food. That is a government that treats us like rubbish.